In the operating room, one of the ways that we can maintain blood pressure is by giving patients IV fluids, because a lot of these patients can be hypovolemic either from their MPO status or from blood loss during the case. Now, knowing how to give somebody the appropriate amount of fluids can be a little bit tricky. But one of the ways that I can make sure that I'm giving enough fluids is by using what's called pulse pressure variation. Pulse pressure variation is a way to look at the blood pressure and see how much variation is going on with the hemodynamics based on a change in the intrathoracic pressure from someone who's getting positive pressure ventilation when they're getting mechanically ventilated. So the equation for pulse pressure variation is going to be the difference in the pulse pressure max minus the min over the average of the two. So you would add the pulse pressure max and the min and then divide that by two. And that fraction you can multiply by 100, which is going to give you your percentage. Anything greater than 12% for pulse pressure variation is going to indicate that that patient could be fluid responsive, meaning that if we gave that patient IV fluids, whether it's crystalloid or albumin, that should help increase their cardiac output, which would then increase their mean arterial pressure. How do we get this data? One of the first things you're going to need is an arterial line. Usually, if you hook up that arterial line to one of your monitors in the operating room, it will automatically give you a pulse pressure variation, and then you can follow that number as you're transfusing either blood or giving IV fluids. And there's four constants that you need to make sure are true for this patient. One is that they're mechanically ventilated and they're getting at least 7 cc's per kilogram per ton of volumes. This ensures that you're providing enough intrathoracic pressure to actually see these physiologic changes that will create the pulse pressure variation. Next, you're going to want to make sure that there's no spontaneous breathing going on, because with spontaneous breathing, there's going to be negative intrathoracic pressure from patients using their own muscles, like their intercostal muscles or their diaphragm, which can then throw off this interplay between intrathoracic pressure and the hemodynamics. Lastly, you're going to want to make sure that your patient is in normal sinus rhythm, because different arrhythmias can obviously disrupt cardiac output and makes pulse pressure variation a lot less reliable. So as long as your patient is in normal sinus rhythm, they're getting at least 7 cc's per kilo, and none of their ventilations are spontaneous, and it's totally mechanically ventilated, these are going to be the patients where you can use pulse pressure variation to guide your resuscitation.